Welcome to today's webinar on Most Integrated Employment Settings, Tools to Advance System Outcomes in Your State. Listening to the webinar, if you do not have sound capabilities on your computer or prefer to listen by phone, dial the numbers to the right of the screen. I have also pasted the numbers into the chat box for your convenience. Listening to the webinar, the audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel. If you accidentally close the panel, you can reopen it by going to the Communicate menu at the top of the screen and choosing Join Audio Broadcast. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right corner of the webinar platform. If you want to make the Media Viewer panel larger, you can minimize other panels like chat, Q&A, and/or participants. Submitted questions. For the Q&A, please use the Q&A box to submit any questions you have during the webinar, and we will direct the questions accordingly during the Q&A portion of the webinar. If you are listening by phone and not logged into the webinar, you may also ask questions by emailing questions to aawosika@ndi-inc.org. Please note this webinar is being recorded and the materials will be placed on the Lead Center website. Technical assistance. If you experience any technical difficulties during the webinar, please use the chat box to send a message to the host, Aramide Woshika, or you may also email her at aawosika@ndi-inc.org. The National Center on Leadership for the Employment and Economic Advancement of People with Disabilities, LEAD, is a collaborative of disability, workforce, and economic empowerment organizations led by National Disability Institute with funding from the United States Department of Labor's Office of Disability Employment Policy. LEAD Center mission: to advance sustainable individual and system-level change that results in improved, competitive, integrated employment and economic self-sufficiency outcomes for individuals across the spectrum of disabilities. You can also visit us at the link provided. Now I hand it over to Chris Button to do a welcome.
Employment setting tool is one that we are very excited about. We hope that you will be as excited after you hear from our awesome speakers and collaborators from the state of Utah about how they have used the tool to help them think about policy in their state and how they might use the information that they have learned from the tool to help promote competitive integrated employment in their state. So we really appreciate you people from Utah, I guess Tricia and Joseph and Amy, taking your time today to be here. And on behalf of ODEP, thanks to all of the people who have signed in. And I guess I'm going to just turn it right over to Richard Davis from ODEP, who's going to explain a little bit about the most integrated employment setting tool to everyone on the call. Thank you.
All right, thanks, Chris. This is Richard here. I just want to make sure, is my audio going through okay? I believe so.
Yes, it is.
All right, I'm going to go ahead and share my screen then so we can walk through the first part, the demo of the website. And just to check, the demo is now showing, correct?
Yes.
Okay, so this is the homepage for the DRIVE website. We actually just did a full walkthrough of all the features on this, the data and resources to inspire a vision of employment, drivedisabilityemployment.org, and that's going to be the easiest way that you can quickly get to the most integrated employment setting tool. So if you look down here on the main page under featured resources, the state self-assessment link is right there, and when you click on it, it opens up to this description page, and you can click on links, which jumps right to the portal there for it. So again, the address at the top you can see is drivedisabilityemployment.org/most-integrated-employment-setting if you want to go directly to this page. So on the introduction page, this sort of gives a little bit of an overview of the tool to facilitate voluntary compliance with federal law, regulation, and guidance designed to prevent the unnecessary segregation of persons with disabilities by entities administering public funds. So the tool was created to assist governors and state administrations in understanding and voluntarily meeting their obligations under Title II of the Americans with Disabilities Act and Section 504 of the Rehabilitation Act of 1973. Both federal laws prevent the unnecessary segregation of persons with disabilities. The tool is specifically focused on assisting governors and state administrations in understanding and voluntarily meeting their obligations in relation to the provision of publicly funded employment and non-work day services to persons with disabilities. For further interpretation of these laws, see the Olmstead versus LC case, also the statement of the United States Department of Justice on enforcement of the integration mandate of Title II of the Americans with Disabilities Act, and Olmstead versus LC, which can be found in Appendix A of this document. So the next place we'll go to is the instructions page on how to use this digital assessment tool before we begin looking at the different available sections. So we'll click on instructions here on the left. And the Most Integrated Settings tool, or MIS, has been developed in system-specific sections to allow different agencies to complete sections relevant to their areas of responsibility and jurisdiction. This digital version of the MIS tool has several special features. So as it says here, each of the different agencies will have their own section that can be filled out separately, and then you can, coordinate across agencies in order to evaluate the different programs that are affected by it. So it is interactive. The questions are interactive. Your response to questions will often trigger a series of follow-up questions. In some cases, your response may trigger additional sections or entire pages of questions. So as you're clicking through, when you answer yes or no to something, new boxes may pop up to input more information. So depending on how you respond, that'll determine how the tool responds to collecting information that you may have on each of those different areas. So response validation. In many sections, your responses will be dates, numbers, or percentages. These digital forms will make sure that your input is valid and will append percentage signs when appropriate. So if you entered something in and then on the next page you enter a number that wasn't consistent, it'll give you a little notification that this doesn't match that and allow you to go back and make sure that the numbers line up. So for example, if you said the number of waivers we have are 5, and then later on in another section you said that, oh, there are 10 here, it'll catch that and say, in the earlier section you said this, please make sure that it's consistent, that kind of thing. So to save and continue later, once you've completed the first page of any of the assessments, you'll be able to use the Save and Continue Later feature, which is always located at the top of the screen to save your work. You'll be provided a link to your partially completed assessment via email so that you can return later and continue to work on your assessment. Review your responses. When you've completed any given section of the MIS tool, you'll be able to review a summary of your responses at the end, and if necessary, go back and revise your answers. You'll also be able to save the summary to your computer as a PDF document, print a copy of the summary, and/or have a copy of the summary sent to your email address. So once you reach the end of a section, it'll prompt you to do all of those things. You can have it emailed, it can generate a PDF, you can go to a page that's printable. There are lots of different ways to get the end result once you've completed a section of the tool. And lastly, privacy and security. Your responses will be confidential and will not be shared with anyone. So as you're working on this document internally, all of the information is kept private. Nobody is able to access that. You'll have security as you're filling out the different things. So Please note some of the sections of the MIS tool require detailed information concerning the regulations that pertain to your agency, the numbers and percentages of people affected by your programs, and/or budget and expenditure numbers from the past 3 fiscal years. You may need to use the Save and Continue Later feature often in order to properly research your responses. So as you hit some of those sections, if you don't have that information readily available while you're filling it out, you can always hit the Save feature, and then you'll have a link emailed that will allow you to reopen where you left off once you have that information to move forward. So I'm going to jump to analyzing results before I go into the demo of the self-assessments itself, just so that we're mindful of ways that you can use this information as you're inputting it in, So there's guidance on analyzing the results of the state self-assessment. As state governments continue to grapple with how best to provide long-term services and supports to individuals with significant disabilities that are integrated, individualized, and focus on optimal socioeconomic advancement and community engagement, the Most Integrated Employment Setting State Self-Assessment Tool is intended to help agencies assess existing policies, service delivery practices, and funding trends to determine both their strengths and gaps in meeting this goal. States are encouraged to use this self-assessment tool for the dual purposes of A, facilitating a cross-systems review of existing policies, enrollment and eligibility processes, capacities of providers and direct support professionals, and funding priorities across systems, and B, initiating a thorough planning process across systems focused on collective action and mutual accountability. A collaborative approach to state planning on service delivery for individuals with disabilities would inform the state's fiscal and budgetary priorities, as well as sharpen the synergies between the various statutory planning activities required by individual state agencies. The Most Integrated Employment Setting tool can help guide states through an exploratory review of strengths, challenges, and gaps the state possesses in meeting its obligations under federal law with respect to the provision of services in the most integrated setting. The results of this voluntary self-assessment can be used to inform future developments in policy, practice, and funding across systems. Specifically, states are encouraged to utilize the results of the state self-assessment to answer the following questions. What steps should the state take to better align policy, practice, and funding? How can the state build and sustain capacity of frontline staff in serving individuals with disabilities in the most integrated setting? What expectations should be placed on providers in order to assure greater access to multiple community-based day and employment services offered in the most integrated setting? And how does the state measure progress in addressing existing gaps and challenges over time? The tool is intended to serve as an internal frame of reference within state government. However, states interested in engaging stakeholders in the Employment First systems change efforts may want to consider publishing some of the results of the Most Integrated Employment Setting tool and use the findings as a guide for facilitating external solutions-oriented discussions. ODEP has developed and collected an inventory of state and federal technical resources through its Employment First State Leadership Mentoring Program that can be used to help states tackle one or more of the areas identified during the Most Integrated Setting state self-assessment process. For more information on ODEP's investments in Employment First efforts, including recommendations, strategies, and effective practices for achieving compliance with federal civil rights laws and public policy, please refer to the agency's website at www.odep.gov/employmentfirst. Finally, states may decide to conduct the state self-assessment on a regular basis to measure perceived progress in addressing challenges across state government agencies over time. So this just lays out the variety of ways that you can use this information in order to get a sense of where you're at, what are some gaps and challenges, and what are some potential strategies and solutions that could be implemented in order to move toward offering the most integrated settings possible. So with that, we're going to go ahead and jump to the left again with the Begin Self-Assessments, and I'll give you a walkthrough of this page. So this is where each of the different tools are homed, and so it says below you will find the links to each section's assessment form. Each link will open in a new window or tab, and you'll be able to proceed with completing that section's assessment. Please keep in mind some sections are longer than others, greatly depending upon how questions are answered. As a reminder, you may take advantage of the Save and Continue Later feature at any time. Your partially completed responses will be saved, and you will be emailed a link to pick up where you left off on that section. So let's go ahead and look just briefly at each of the different sections that are available. And you also notice down in the bottom right it says download a hard copy of the Section 2 self-assessment. So if you wish, you could even make printed copies of this to fill out by hand or that kind of thing. But the tool itself will generate a final report if you choose to do it electronically. So Section 2 is the first one, State Olmstead Plan, Statutes, Rules, Executive Orders, and Litigation. Section 3 is on State Medicaid Plan and Medicaid Home and Community-Based Services waivers. Section 4 is on Money Follows the Person rebalancing demonstration. Section 5 is on State Vocational Rehabilitation. Section 6 is on the State Workforce Program. Section 7 is on State Education and Special Education Program. Section 8 is on State Use Programs, and Section 9 is on State Tax Credits and related employer incentives. So I won't go through every single one of these as a demo, but I will just give you some examples of, we'll start with State Vocational Rehabilitation, and then we'll do another one just as a point of comparison. So it says, for example, in this section, you will assess how vocational rehabilitation programs are managed in your state, list the number of individuals who have been closed as unable to benefit from VR services in the last 5 years, and detail on how the state VR agency authorizes services for disabled individuals. So if we click on Section 5 assessment, begin the Section 5 assessment now, you'll come to this opening page, State Vocational Rehabilitation, and it'll ask for your agency name and state. So I'm just going to put in demo for now. And since I'm in Washington, D.C., I'll put D.C. just randomly for this. So does the current state VR data system allow for tracking of the following? And so then you would answer yes or no for each of these. So it says VR applicants employed in a facility-based work center at the time of application. So if I put yes, it'll say what percentage of all VR applicants were employed in a facility-based work center at the time of application during the most recently completed state fiscal year. So let's say if that's 10%, I'll type in 10, and automatically the percentage sign pops there since it's a percentage-based question. Question 2, VR applicants enrolled in a facilities program or service at the time of application. I'll put no for a few of these as we go down, just to keep moving along. And for the last one, we'll say VR consumers who are enrolled in a facility-based day program or service at the time of case closure, where such closure occurs before the development of an individual plan for employment. If I put yes here, again, it'll ask what's the percentage, so I'll just put maybe 5% for that one. Whoops. All right, so when we hit the next button, it then says, does working in a facility-based work center at the time of application cause the VR applicant to be treated any differently by the counselor assigned? So if I click no, nothing pops up. If I click yes, it asks, how is the applicant treated differently by the counselor assigned? And so maybe for the sake of this, I'm just going to use demo to show you, but any text that you enter in, because this is meant as a self-assessment tool, really is just notes for your reference. Once the final report is generated, all of that will be captured so that you have as a point to refer back to. So we'll be able to see where I've marked demo in some of these text boxes. Is this different treatment required through written policy? If I put yes or no, I can put no for that one. If a VR consumer is enrolled in a facility-based day program or service at the time of VR case closure, is there any secondary review of the closure by a VR supervisor or other designated VR personnel to determine 7A, if every reasonable effort to move forward with the development of an IPE has been made, and if inability to benefit from services is one reason for the closure, that discovery in lieu of a traditional vocational evaluation or assessment or trial work experiences has been used to determine ability to benefit. So I can just kind of click yes for those. How many VR applicants or VR individuals have been closed as unable to benefit from VR services in the last 5 years? So this might be one where if you don't know that number, I'm just going to randomly put 111. But you can go up to the Save and Continue Later feature. And so at the top it expands and says, please supply an email address to save your progress. A unique link will be emailed to you that will allow you to return where you left off. So you put your email and verify it and click Save, and then that would actually save where the information you've entered already. But for now, I'm just going to click Never Mind and continue going forward. So for this group, if known, please report the following: number who were working in facility-based work center at time of application. Let's just say I'll put 5. Number who were enrolled in a facility-based program and service application. I'll just put 5 down the board for each of these so that we can keep moving through this demo. And again, you'll see all this information, how it's organized at the end too once we reach that. How many VR consumers have been closed into sheltered employment since 2000? So let's say we put 20. Does the VR agency do any follow-up contacts with these VR consumers to offer the opportunity to receive VR services to transition into integrated employment at competitive wages? If we click yes, how often is this follow-up done with each VR consumer? So we could say maybe twice a year. How is the follow-up done and by whom? We could say provider schedules follow-up. And what percentage of VR consumers closed into sheltered employment since 2000 have taken the opportunity to receive VR services to transition into integrated employment at competitive wages? And we could just say maybe 40%. Of this group, what percentage has successfully closed into integrated employment at competitive wages? And maybe we'll say that out of that 40, 30%. So let's see here, and we'll click next. Does the state VR agency permit authorization of services which are delivered in a facility-based work center setting? And if we click yes, it says how many VR consumers received VR-funded services in that setting, so we could maybe put 10. What was the total financial investment in these over the last 3 years? I might just put a random number, 100 for now, and that automatically changes to dollars, but obviously it's going to be different. In the past 5 years, has the VR agency identified VR consumers working in facility-based work centers as an underserved group? If we click yes here, it says what plan of action has been implemented to address this underserved group. I'm just going to put demo, but you can go into more details in each of these sections. What has the result been of the effort? Well, again, we'll just put demo for now, but that allows you the ability to include that feedback in the report. Does the VR agency do any routine targeted outreach to VR consumers working in facility-based work centers to explain the services available through VR? So let's say I put yes. What's the frequency and nature? Again, for these, I'm just going to fill in demo. And if an eligible individual is actively considering receiving services in a facility-based work center, is the VR agency called in to provide information or assistance to ensure informed choice by the individual or his or her legal guardian if one is appointed? If you click yes, it says describe the type of information or assistance provided to ensure informed choice. So again, we just put demo there. So at this point, it says you've completed Section 5, State Vocational Rehabilitation, and as you saw, depending on how I answered the questions, it opened up different follow-up questions, different boxes to provide more specific detailed information, and it's really up to the individual filling out to decide, you know, how much information to include, and really this is just meant to be a self-assessment tool that's for you. So whatever information that's important to include, you can use those to put that information in. So now, it says you have two options for receiving a copy of your responses. You can select both options. So one is to send a summary of my Section 5 assessment to my email address. So for that one, if I check it, it'll ask me for my email, and it will just email it to me. The other is to view my response summary online or export it to my computer in a PDF format. So let's go ahead and check that box. And when I click next, it'll say your response. There is a link to download a PDF version of this report at the bottom of the page. So now, as you can see here, all of the questions that we answered, it shows you the question in bold, and it shows you the responses below. All of the places I filled in demo are there. Any of the ones that expanded out, for example, the number of individuals in each type of employment setting, the facility-based programs and services, the 555s are all recorded there. And as we scroll all the way down to the bottom, it says download PDF version. So again, if you click on this link, a little box just popped up in the bottom of my screen, and that allows the download of the PDF. Sorry, my computer is taking a second here. There we go. And then there you can see the PDF is also saved with all of those responses, so you can export and share that however you may need to. So going from that, a new window pops open for each section. So I'm going to go back up to the top tab to take us back to the main page. And just to show a little bit of comparison, I don't know if I'm going to go the whole way through or not before we turn over to the panel, but I did want to show maybe, where did it go? The state Medicaid plan and Medicaid HCBS waivers. So if we begin this assessment, just to kind of compare the different sections and the types of questions that are asked. So again, I'm going to put demo, District of Columbia. And the first question here is, which of the following optional Medicaid state plan services are available under the Medicaid state plan? So depending on how many of these you check, that will determine the number of questions you're asked. So I'm actually only going to check the one up here, rehabilitation, for now, just to move quickly through the demo. How do these services support employment in integrated settings? So rehabilitation, is this service available to adults with disabilities? We'll say yes. Does the definition of this service explicitly state that the service can support employment in integrated settings? Yes. And does state data system allow tracking of service utilization and spending specific to supporting employment in integrated settings? If I checked yes. How many adults with disabilities received these services in the most recently completed state fiscal year? Let's just put 111. And what was the total expenditure for adults with disabilities? We'll just put 1,000 for now. All right. Next question, what services are available under the Medicaid state plan that support or fund facility-based work centers, facility-based pre-vocational services, or facility-based non-work services? Check all that apply. So again, the more of these that are checked, the more questions pop up. So I'm just going to click on, we'll say day treatment habilitation, and then it asks these questions. Please provide additional info about this service category, supports funds, check all that apply. So let's say facility-based non-work services, number of adults receiving the services, we'll just say 11, total expenditures 100, just to have some numbers there. Does the state have a plan amendment approved under section 1915I? We'll click yes. Does the 1915I target working age people with disabilities? We click yes. What specific disability populations are targeted? I'm just going to put demo for now. Are day treatment habilitation services included? What settings are permitted? Facility-based only, community-based only, both facility and community-based. Are pre-vocational services included? Let's say we put yes. More questions drop down. How are these pre-vocational services included? They're a separate service category, or they are part of a day treatment habilitation. What settings are permitted? Are individuals receiving these services supported in preparing for integrated employment? What employment-specific services are covered under the 1915I? I'm just going to put demo for these, and then hopefully move a little bit forward here. But again, you can just kind of see this section is very detailed, just like the other one on vocational rehabilitation was, and so it just goes very in-depth on the amount of questions and information that you can really capture by filling this out. Does the state have a state plan amendment approved under 1915K? I'm just going to put no in order to move through some of these parts here. Just out of curiosity, is the purchase of technology to replace human assistance permitted to support employment in integrated settings? Is the ability to use technology to support employment clearly and explicitly stated in the service definition? So we'll just kind of fill those out there. So this one on state Medicaid HCBS waivers, for which of the following categories does your state offer Medicaid HCBS waivers covering individuals 18 to 64? Let's just, for this one, we'll just check the box, individuals with intellectual and developmental disabilities. How many state Medicaid HCBS waivers do you have covering individuals 18 to 64? I'm actually going to put 2, just so that way it moves through faster. Under which authorities? I'm just going to check 1915C. At this point it says, what's the waiver name? We'll put demo. And notice it says waiver 1 of 2. So if I would have put that we have 10 waivers, it would have brought this up for 10 different ones, but I'm just going to do it for 1 and 2 so that you can see how that works. Which of the following services are covered under this waiver? I'm just going to check the one box there, which opens up this service type question, allowable settings. We'll click just community-based, number of individuals served. I'm just going to put 111, total units purchased, and again, I'll just put 111. Now waiver 2, I'll just put demo 2, and let's say this one is on supported employment combined, community-based, 111, 111. So I'm just using those as examples to move through the tool. So the next question, has the agency responsible for programmatic administration and oversight of the home and community-based waivers that serve people with intellectual and developmental disabilities implemented any of the following? So one is a time limit on pre-vocational services. we'll just click yes for most of these here to continue moving through. And at that point, it says you've completed Section 3 of the state Medicaid plan and Medicaid HCBS waivers. Again, you can go back to review my response summary or export to PDF. When I click next, it'll have a full drop down of all of the different sections that were filled out, along with the responses to those questions. So that kind of gives you an example of, you know, two of the different sections, how they're similar, how they're different, how the format of the electronic tool works. Again, you can always download the hard copy of all of these questions, which is a more expanded format. But it also, I think, saves some paper, too, with the PDF one. If you decide to do it electronically, it only expands the questions that you answer yes or no to that have more information to fill out there. So that might be helpful as well, to do it electronically and then generate the PDF report at the end. But that pretty much concludes all of the features of the tool. And so with that, I'm going to go ahead and turn it back over to the presentation, and then we will hear from our panel next. So with that, I will turn it over. Thank you.
Thanks so much, Richard. What a very thorough presentation and demonstration of the most integrated employment settings tool. We really appreciate it, and you set the stage so well for us. So speaking here is Rose Sloan. I am a policy advisor at the Office of Disability Employment Policy. I'm Richard's colleague, and I have the pleasure of moderating our panel today. We have 3 individuals from the state of Utah, from various state agencies there. And I'm going to, instead of introducing them, allow them to introduce themselves so that we can hear their voices since they'll be answering questions as we go. So, Tricia, I'm going to start with you. Please introduce yourself.
I'm Tricia Jones-Parkin, and I work for the Division of Services for People with Disabilities. And we are the entity that delivers disability services for people with intellectual disabilities and related conditions, and I am the Employment First Program Administrator for the state.
Thanks so much, Tricia. And then next we'll have Amy introduce herself.
Hi, I am Amy Langoni, and I work for the Utah State Office of Rehabilitation, otherwise known as Voc Rehab, and I am the Transition Employment Coordinator.
Great, thank you. And then we have Joseph.
Yes, I'm Joseph Ambernack. I work with the Division of Medicaid and Health Financing at the Utah Department of Health. We provide the oversight for the state's 8 home and community-based waiver programs through the 1915C Authority.
Thank you so much. Okay, so now I'm going to just ask each of you, first we'll start with Trish, then Amy, then Joseph, which sections of the tool did you fill out, and how long did it take you to fill out your section of the tool? Tricia?
Sorry, I muted myself. I apologize.
Oh, all good.
So when Rose contacted me about Utah participating in this demo project, as we learned about it, responsibility of entering into the site that Richard just demoed each of the sections. However, I did take the lead in the tax credit section, the state use section. I coordinated with our entity that has the state use contract for that information, and then also supplemented some of the pieces around the waiver part. I think Joseph did the majority of that. And so, but I actually did enter in all of it, and I didn't keep track of each of those sections. Certainly the state use section is pretty small. I don't think it'd take more than 5 to 10 minutes. Tax credit section was also pretty small, about the same amount of time.
Okay, great. And Amy, did you get to fill out part of the MIS toolkit?
Yes, I provided Tricia with information on the state vocational rehabilitation section, and that section about 20 minutes to complete.
Okay, good to know. And then let's see, Joseph, Trish had said that you helped a lot with the, I believe, the waiver part. Is that correct?
Correct, Section 3, and we also provided some assistance with Sections 2 and 4 as well. I think the longest was certainly 3, where there was an expectation of tracking the financial expenditures as well. I would say in total we've probably spent about 30 to 40 minutes on that, some of which was kind of ensuring that the data we were pulling were good and reconciling some of that, but the actual inputting or answering the questions was not time intensive.
Very good. Thank you so much for that. So it seems that it's useful to allow all agencies that are participating in filling out this tool to see the whole thing, because some sections may be relevant to more than one person. And it's based on what you said, it didn't sound like it took all that much time, perhaps, 20 minutes for one section, 30 minutes for another. But at the end, you probably came out with something that was really, really useful. So we'll get to that in just a minute. But, Trish, when you use the tool, can you tell me about it? Like, did you find the format easy to use, for example?
I did. Once I kind of took the time to look through it and, understand what the questions were and how, if you answered no, again, to what Richard demoed earlier, that there were some sections that you had to research a little bit more, or I don't know the answer to that, so I'm going to research it. But I found the format to be very useful. I loved that I could save and come back to it. So in case, my computer went to sleep or something and I didn't save where I was, feature to be able to go back and finish, especially as we were collaborating amongst partners to get some information in, or I have this part done, but I'm still waiting for this. It was really helpful to be able to do that, and it was really easy to use.
Great, thank you. And then, our goal was, as you were filling out the tool in your various sections, that, you would find it useful in some way. So I guess we'll start with Trish again. How did you find the tool useful?
I think for me, just overall, looking at the questions that were asked, our Employment First legislation passed in 2011. We've, had our unified state plan. We've been tracking certain things. But what I realized when I was looking through the tool and the questions, that there were a lot of things that we weren't considering across agencies. Lavinia Grippentrog wasn't able to join us today through special education, but there were a lot of sections that they are not currently looking at, and so certainly an opportunity to examine, gosh, this is information that we don't know and that we probably should know. So I think that was the biggest overall thing for me, asking questions about our Olmstead plan and looking into that. Those are things that I didn't know what the current status was, and also very relevant to all the work that we're doing. So I think that initial takeaway was, yes, we're doing some really good things here and we're making some great strides around aligning policy and practice, but this tool really is another way to dig deeper in terms of what we're tracking, and as we're looking at people moving from segregated to integrated services.
And Amy, did you find the tool useful? Did you have any specific examples of how it opened your eyes to maybe something you should do more of, or maybe opened your eyes of, hey, I think we're actually doing a really good job in this area?
Yeah, I think I found it useful, and I would just mirror what Tricia said and then add that it's a concise way for us to compare what other state partners are collecting as far as data goes, and to help us do better about what we need to do in the future.
Cool. And Joseph, do you have any comments to add?
Really just having a little bit more concise information about what the other partnering agencies are doing. So having a better understanding of what Voc Rehab or special ed programs are doing, and perhaps a little bit more of a reflection on how we can better share data as well. So while we were kind of compiling the expenditure data, it's something that's pretty rudimentary for us, yet perhaps not recognizing the value that it does hold to other partnering agencies.
Very good. We're glad you had a good experience with that. So now we'll move on to the next question, which is what next steps do you envision taking after filling out this tool? And I'll start with Trish first.
Okay. Our next steps are, really that analyzing the data section, to me, was pretty helpful. You know, it's pretty overwhelming to look at all of those sections. And, you know, in my mind, as I was entering that that information, the sections that we were saying no to, it did feel a little overwhelming in a way, just knowing there were lots of areas that we needed to improve on or that we weren't tracking and what that would look like. So for me to kind of look at that, analyze the data section, and giving those recommendations was really helpful. So the first steps that we've done now that we have completed all of the sections is I contacted our agency director and asked if we could present the information or kind of what we went through to our coordinating council for persons with disabilities. So this is an interagency representation of agency directors that get together and talk about employment-related issues and lots of other kinds of service-related issues to make sure that they understand what we went through with the tool, and then kind of give us some guidance around next steps in terms of analyzing it, breaking down what are some things that we can accomplish in the next 3 months, 6 months, that sort of a thing in terms of an action plan, and then getting a work group together from all of the agencies that are represented to be able to make some improvements and, you know, create those measures individually in each agency, and then also kind of that broader collaborative measuring of information.
Thanks, Trish. And Amy, did you have anything as far as next steps that you might envision or hope to take?
No, I think Tricia summed it up, what our plan is next. I don't have anything to add.
And I'll just double check with Joseph just to make sure.
And perhaps just to build on what Tricia mentioned too, but having some of the employment first work also align with what we're doing on the HCBS settings front. I think we see a lot of opportunities to kind of align a lot of those goals as well.
Perfect. And then the last question I have, and then we'll open it up to all of our participants on the webinar through the Q&A box. But my question is, Trish, would you recommend this tool to other states?
I would. You know, again, when you reached out to me, there was certainly that sense of vulnerability, right? Like when, as a state person, you're doing all this work and you're pushing forward and you kind of have this vision to take the step to go through this assessment and be vulnerable to what the results might be. You kind of have to go through that. And the process that I went through is I reached out to all of the agency directors and then the folks that I knew that would be filling out the information and said, hey, we have this opportunity. I think it would be really great for us to go through this and then, you know, kind of really see where we are. I'm sure that there are things that we're going to find some gaps and ways that we can improve. And every single representative and every one of those directors said that they supported going through this process. So I think that was really helpful. And I also think, you know, we've also been partnering in our Employment First State Leadership Mentoring program with all of these agencies, so that groundwork in terms of collaboration and trust was already set. But there still was that vulnerability piece. But for me, representing, you know, our agency, I think it was really valuable to go through, and I would definitely recommend states to take the time to do it.
Amy, do you have any further comments?
No, I just would say that I would recommend it to other states as well. I think you can take discussion on what states are doing to facilitate competitive integrated employment outcomes for clients in their state. And then also, at least for the VR section, it does bring up some talking points for best practices, such as considering discovery activities prior to case closure and things like that. So I would definitely recommend it to other states.
Yay, we're so excited to hear that. And Joseph, would you recommend it?
Absolutely. It's definitely a worthwhile investment to ensure that you have solid information in decision-making processes. This helps solidify a lot of the things that I think we thought we knew, but perhaps expounding on that a little bit more and having more data available from each of the partnering agencies.
Thanks so much. And, you know, I want to commend Utah. You know, they were the first. They, you know, rose to the occasion. They, you know, took on this tool, you know, head on. And, you know, they found it very useful, and we think others will too. So now we have the opportunity for our guests here in the webinar to, ask any questions that you may have through the Q&A box. So, Aramide, do we have any questions yet?
Yes, we've had 2 questions come in. The first one is, do you think they will use this again periodically to track their progress over time?
Trish, do you want to take a stab at that first?
Yes, I anticipate that being something that we do. I'm assuming annually, right? That gives us time to, to implement some of the pieces, create an action plan based on what we've learned, and then just annually that this is, something that we do to check. And I think it's easy to do it that way, and you can compare information. I'm going to be meeting with our data folks before the coordinating council meeting to try to kind of compile where we're at and in somewhat of a format that, will be a good way to present the information, and I think that will be helpful.
Awesome. And, Amy and Joseph, does annually sound about right to you? Would you recommend, more often than that, less often than that?
This is Amy. I think it would depend on the changes that each of our agencies make. So I could see us using it more frequently if we make significant changes, but I think annually is a good target to have.
Yeah, and I think annual would also kind of align with a lot of how we generate expenditure data here. Certainly a lot can change in a very short period of time, especially when you're talking about Olmstead challenges or other perhaps legislation that is passed, but I think that will be our plan as well.
Very good. All right, Aramide, I think you mentioned there's another question?
Yes. Where can you find a good federal definition of facility-based?
I guess to rephrase the question, Trish and team, when you filled out the tool, what did you consider facility-based to mean, or how did you interpret that? We will look for a definition as well, but I'm just curious to know how you interpreted that.
This is Tricia. When we looked at it, and I'll let Joseph speak to it too, because he did more of the initial, the numbers piece in terms of the waiver portion of the assessment. In Utah, we do not actually make a distinction if somebody's doing sheltered work or if they're participating in kind of non-work activities in a facility or even community-based. So to me, that was a place that we could really start to make that distinction where people are spending their time. So, and obviously that's something that's on everybody's mind with the settings rule, transition plans and those sorts of things. So again, it was just a validation of, yes, we need to be looking at this differently and tracking that information differently. But I mean, it was really, is a person going to a building that is licensed to provide services to people with disabilities in a particular setting is how we identified it. And I think we were able to just kind of use those numbers based on that particular service code that we know happens in majority of those facilities.
Thanks so much for that. Another question that sort of came to mind is like, do you have a specific collaboration activities that you're hoping to take on after using this tool?
Yeah, I mean, I think I mentioned it before as far as our next steps, but I think the plan is to get together and say, okay, this is what the data looks like. This is, where do we go from here? How do we break down what we can do in the next, create a timeline and then meet regularly as partner agencies, looking at, we have agreements in place. Again, all of this kind of work is also being addressed in our Employment First State Leadership Mentoring program work that we've done. We have some of these initiatives in our PI grant. So I think just aligning all of those and this tool just really strengthens that.
This is Chris Button from ODEP. That's really, really great to hear. The first step of our Employment First State Leadership Mentoring program is having our subject matter experts work with the states to do kind of a policy scan and to look at the environment, the policy environment of the state, to see where there's alignment, to see what things might be able to be done. Not that the SME figures, the subject matter expert figures that out, just that they assist the state with the analysis. And one of the things that we were really excited about with the most integrated employment setting tool is that it can help the state implement, without the help of an SME necessarily, kind of the analysis of the policies across each one of the respective areas, and that there's no expectation that one person do it all, that it's a team activity with each system, with the more in-depth knowledge about that system, doing the analysis so that when the team comes together, you can do exactly what Utah leaders are talking about right now, and do your analysis and kind of figure out what kinds of activities can we implement to move the needle, if you will, in terms of increasing competitive integrated employment. What are the various areas where it might be useful to really focus our energy and our activities? And it's never that it's only one area, of course, but what this does is allows the state to see the scan across systems so that the team or the individual agencies can really, in a more kind of concise way, see what's going on and maybe have some potential areas of activity or areas of collaboration across systems kind of come to the top that would be good next steps for the various systems for the state to be working on.
Thanks, Chris. Aramide, do we have any more questions?
Yes, a very good question that just came in. This is a tool to be used by a state. Please describe which division of a state would use this plan: vocational, rehabilitation, agencies for persons with disabilities, etc. And also a second part to the question is, will this tool be used to compare and measure performance by state? Yeah.
So the answer to the first,
that?
No, so the answer to the first question, I would imagine, would be yes. There's many state agencies that you would want to pull in to help fill out the tool. I'll let Utah speak to this as well, because, we purposely did bring in, many individuals so that they could talk about their perspectives from their various agencies.
This is Tricia. We, yes, had the, Amy from Voc Rehab complete the section, Joseph from the Department of Health, myself from the Developmental Disability Agency. We had a person from the Workforce Agency complete it. She just wasn't able to join us for the webinar. We had a person from our Special Education Transition Department fill out the section around, for the education piece. And then I kind of looked through there's the state use part and the tax credits, and kind of partnered with folks who were working on that and completed those sections based on the information that they gave me. But I did identify and get those numbers from those folks. But yeah, it was a collaborative partnership from all of the agencies represented.
And then what was the second part of the question, Aramide?
Will this tool be used to compare and measure performance by state?
So this is a self-assessment for states to use on their own. No states will be compared to another state.
Nor will they have to report the data forward, at least in terms of a toolkit response. This is, as Rose said, solely for the state to use for their own purposes. It's a tool to help them, kind of guide them through the various aspects of policy across each system that is relevant to increasing competitive integrated employment.
Yeah, this is Richard. This is just a point of clarification. I saw a question to come in that they saw that there's a state comparisons tab at the top. That's actually for the Drive website for the data that's on there. The information that's entered in this tool is all private. So as I mentioned in the beginning on the introduction, none of this information is shared. So the question was like, once states enter their things, can they compare that? That would be a no, because this is all private to whoever the individual is that's, you know, filling it out and saving it privately for a self-assessment. The state comparisons tab that you saw on the demo page, that's actually because it's within the frame of the Drive website. That's for comparing different data that's publicly available that's unrelated to the tool, though.
Do we have more questions?
Yes. Can you talk more about the tax incentive section and how long it takes to fill it out?
I'm going to turn that over to Utah team.
You know, it was fairly brief because we do not have a lot of tax incentives that are specifically state specific. So it didn't take us very long.
Yeah, I mean, it could take other states longer depending on, you know, which services your state happens to provide. And, you know, Utah, we're so grateful they're here, and we're so excited that they filled out the tool. But as we know, with state policy, each state has their own, and it might take another state a little bit longer, a little bit less time to fill out certain sections. Aramade, do we have any more questions?
Yes. Are there results analysis, a summary of entered responses, or is there a specific guidance provided?
Richard, do you want to take that question?
Can you repeat that again? You said...
Sure. Are the results analysis a summary of entered responses, or is there specific guidance provided?
No, so it's just a summary of everything that's entered in. So no additional guidance is generated based on your responses. So really, again, this is all meant to be a tool that the state uses. So by collecting this information, putting it all into one document, it allows ease of communication across agencies and that kind of thing, but there's no analysis that's created. So you'll notice on the main page there was the Analyzing Results tab. Those are recommendations on how you can apply the information once it's entered, but this is really just a tool for you to assess where the gaps, where the strengths, and where the areas that could be improved, but there's no like report generated based on the input. It just summarizes what's entered as you go along.
And I also think, though, that as states start entering the data, you know, based on the answers to the questions, it might sort of click in your mind like, oh, maybe we should be doing this. Maybe the answer should be yes, but right now the answer is no, that type of feel. The state is supposed to assess themselves and sort of realize, you know, where they're really strong and places maybe where they could improve, and then those places that they feel they need to improve is sort of where they take their next steps.
And
yeah, I think that's cool. Oh, go ahead.
Now, I just want to say I want to really reinforce something that Richard said, and that is that this is a private, confidential analysis. This is not a report that will be turned in anywhere. This is purely for your own use to think about areas that you could focus your energy on based on the report that is kind of comes out that results from the analysis from each one of the systems, so that you can look across all the systems and see areas of potential collaboration, things that you could work on, and you can also look within your own system and look at things that you could work on. But the report is not something that is turned in anywhere. It is only for your own use.
Yeah, and I just wanted to add to Rose's point, too. I think that one of the functions of the tool is if you're looking at wanting to know more and get some insight that can help guide policy development or systems change within your state, and you're saying, what questions should we be asking? The idea behind this tool is that it's comprehensive and asks all the right questions. So this way, if there was anything you may have forgotten to ask or hadn't included, the idea of using these different tools makes sure you cover all the different bases, all the different angles, and think about where there might be gaps. So it's just meant to assist with that process and to help identify questions you might not have even thought to ask about current policies, programs, waivers, those kinds of things. And the questions also help generate ideas and discussion on ways that if there is a gap in that area that it could be improved. So I think that's the main function of it, is to really be able to assess things holistically and get a grip on where things are strong, where things could be improved, and then to start the discussion around addressing those areas, if that makes sense.
This is Tricia. I just want to add to that. Sorry, I was just going to say, I think, you know, as I think about several conversations that a lot of the folks, you know, from Utah on the call have been involved in it, and other leaders, is you know, we're tracking things, but we're not tracking all the right things. And so getting some help on the values, or kind of asking some of these questions, or even looking at things that we weren't considering, is really, really helpful. And I don't think we're going to have a problem convincing folks to say we need to be collecting this. How do we add it, or where does it make sense to add it? I think it's just knowing that these are some ways that these are the ways that you can ask this question, or these are the values that we need to be looking at.
Thanks, Tricia. Ramade, do we have more questions?
Yeah, the next question is, how are states being encouraged to use this tool?
Well, I will say that this webinar is the official release of the tool. So through this webinar, we are encouraging folks to use this tool. I think we're still in development of ideas on how to encourage states to use this tool, but, you know, any word of mouth would be much appreciated as well.
I think we'll certainly be, this is Chris, we'll certainly be promoting it through our Employment First State Leadership Mentoring Program. There's other work that the Office of Disability Employment Policy does with the states through other initiatives, and every place we have an opportunity, we will be promoting the tool, because we do feel that it's just a really helpful analysis for each state system to go through, as we've said multiple times, both individually and also as a team across systems, to see where collaborations can happen across systems, or where work can be done within an individual system to move the needle, to continue to advance competitive integrated employment through a variety of different policy activities, whether it's development of some collaboration activities across systems, whether it's development of an MOU perhaps, or some other activity that might come to mind as a result of the analysis.
Thank you, Chris. The next question is, would this be helpful for states that do not have employment first legislations?
Absolutely.
The analysis that happens when you go through the tool is very informative for a state. So even if a state has not officially passed something that they are officially calling an Employment First initiative, within each of the policy system areas, the analysis is very useful for the state within each of those systems to think about what they're doing and to identify areas of activity that they could be doing in order to increase employment for youth and adults with disabilities. So they don't have to be calling it Employment First. This was developed through and with our Employment First State Leadership Mentoring Program, but it's about increasing employment. And it's about all the systems that are really important to making employment a reality for youth and adults with disabilities. So it can be helpful regardless of whether the state has officially named themselves an Employment First state and is kind of moving forward under that header. It still can be very useful. It's about employment.
Okay. The talk about state using this, a question came in, wanted to know about individual agencies like nonprofit with working with people with disabilities.
Can you read the exact question, Arimide, please?
So the talk about state using this, I think one question asked about individual agencies. An example would be nonprofit organizations working with people with disabilities. Could they also use this tool to assess themselves?
This is Chris. My sense is that this was developed for the use of state agencies. That said, you know what? If I was a nonprofit agency, I'd be very interested in looking through the tool, because it's going to teach me just through the questioning about different areas of policy across systems. And sometimes community nonprofit employment systems or agencies are a part of task forces that a state may organize. So I guess my reaction, and I'd be interested in Richard and Rose's reaction as well, but my reaction is it certainly will not hurt and could only help some system that is working with the state to be familiar with the tool and to look at the tool also, although the primary audience that the tool is intended for is the state agencies.
Yeah, I think there are many, many uses for the tool, and I think that once the tool is completed, perhaps the clever idea might be to share it with nonprofits, so they might be able to learn a little bit more about like which services are available in case maybe they weren't aware, and maybe in case they had some questions about it. Perhaps after the tool was complete, maybe they had some things to add, because, you know, you could always go back into the tool and update it, you know, as Tricia was saying. Richard, feel free to chime in, but I'm also curious to know, you know, from Utah's perspective, you know, could you imagine this being useful for nonprofits in your state, or how might you involve them, or might you hesitate for some reason? Just curious on your thoughts.
This is Tricia. I wouldn't necessarily hesitate. I agree with what Chris said in terms of, you know, provider agencies or partners looking at what it is, where the values are, right? Like we're tracking people moving from segregated settings to community-based settings, and, you know, knowing who is in where, who isn't, and, you know, I mean, there's lots and lots of questions about that. Or the state use contract section that asks about, are people in facility-based settings doing this work, and is there an effort to minimize that? So I think it really does guide and strengthen the conversation that we're all having as a state and with our provider partners about the shift to community-based integrated services, and this just strengthens that this is what we're tracking. It's going to be what we're looking for. So I turn some time over to Joseph too, you know, from the Department of Health for thoughts on that.
I think a lot of the elements are items that we do report on publicly that we do try to make available. I can see why having everything grouped together could be of benefit to an individual, but I don't see any hesitation in why we wouldn't make this accessible to an entity who is interested.
This is Chris again. Thanks for those responses. I think that a state could, as you guys are saying, make it available to, say, a nonprofit provider that you're working with. You could also choose to make certain parts of it available. It's a private filling out of a tool. So you could decide to use the information any way that you want to, either in whole or in part. And again, if I was a nonprofit working with the state systems, it might be interesting for me, without it having been filled out yet by the state, just to look at the questions that were being asked, because I think, as Rose said, you might learn, the nonprofit might be learning more about some of the systems just from the questions, without the questions even being responded to yet, learning in greater depth about those particular systems and some areas maybe where they could be collaborating with the state or looking to the state for increasing their numbers or decreasing their numbers depending on what the question is. So I guess that's a really great question, whoever asked it from out in the roots out there, because there's so many different responses Yes, it can be shared by the agency in whole. Yes, it could be shared by the agency in part. Yes, the agency could pick and choose different parts of it and create a little fact sheet if they wanted to. Yes, the provider system could look through the blank tool just to use it as an educational process to learn about the various systems and various areas of collaboration. Yes, the nonprofit agency could gather, if the state is willing to share parts of it, different pieces of it, and use that information in so many different ways, both in their own work with individuals, with families, with, you know, informing other people about the services that they provide, perhaps, and how that relates to information that the state is interested in looking at. So lots of different iterations for why the tool can be useful to multiple different audiences, even though the primary audience is intended to be the state systems.
Thank you, Chris. The next question is, how did you overcome the different definitions of disability and employment used by the different agencies involved? It appears the definitions come from different federal laws that govern the various agencies.
Tricia, when you were going through the tool, did you have any difficulty or confusion with that?
You know, I didn't, and I think it, especially when you're digging into the tool, specifically about, like in the community-based, you know, in the waiver sections, it asks the target areas that you're serving, and so to me that alleviated the confusion, because then you're kind of talking about, you're putting those numbers or some of those pieces directly specific to that population. I'll let Amy speak to the voc rehab piece, but you know, I think we have primarily served folks in supported employment or need those significant supports for folks who have most significant disabilities. So I didn't feel like there was a question about who we were talking about because it was targeted at each agency in terms of who they were serving. And like the special education questions are very targeted to, you know, our students transitioning to sheltered work, or, you know, what are those outcomes that guides you in terms of the populations that you're talking about.
Yeah, this is Amy. I just filled out the VR section, and I used my own paradigm to fill it out. So I really considered the joint consumers that we have, and I didn't feel like there was any questions on the definitions.
Do we have more questions, Ramade?
Yes. Do you have a sample of a final report that integrates the different sections?
Richard?
No, I don't think we have a sample report yet, but I mean, like I said, because we just launched this today, if that would be helpful, though, we could have, you know, just like a sample one with, you know, generic information that's not any, you know, specific states, just so people can see it as a reference point, though. But at this time, no, there's no example of those. But if you wanted to just see what's there, you could, you know, just like I did with the demo part, you know, type in each box and generate the final PDF at the end. Or you can download the hard copy, which includes the blank sections. But again, because it's only just organizing the information that you, the person filling it out, enters, the demo is basically, you know, an example version is just going to be filled in with information that would be on the hard copies. But we can do that, though. We could maybe have a sample that includes all of the different sections in, you know, as examples at the for each one,
to
see what the final report looks like.
I actually think that's a really good idea, and I think that we could add to it some suggestions for how some of the information might be used, you know, that in terms of within the state system or across state systems, or even by private entities who might be interested in collaborating with the systems. So I think we should do that. So thank you for the question, whoever submitted it.
Thanks, Chris. The next question is there any part of the tool that asks if there were any issues with funding the process to assist folks with finding community integrated employment?
This is Tricia.
Go ahead.
I don't think there's a specific thing about the process. I mean, ideally, as you're filling it out, you might be able to identify then that, oh, this is a reason why funding could be an issue, or funding certain services is an issue due to policies not being aligned properly, or certain practices not being funded. So I don't think there's anything to that question specifically that asks about that. But I mean, looking at it holistically, hopefully that when you fill out this, you're able to identify where some of those gaps might be in order to begin that discussion, and identify what changes would need to be made in order to help align policy, practice, and funding.
Hey, thank you, Richard. Oh, go ahead, Ruth.
Oh, no, I was just going to see if the Utah team had any comments on that question.
I don't recall any specific questions. I would kind of mirror what Richard said, that the purpose of the assessment would kind of guide you to say, yeah, we need to prioritize, these particular things, or shift the funding, or those sorts of things. But there's not a specific question about funding.
Thanks.
The next question is, when the tool is used, will this help the state be able to recognize areas that are having difficulties with getting individuals hired for employment? And the second part is, how are community employers and individual families being informed of these regulation changes?
Well, let's take this is Chris. Let's take the second part of those questions first, and that is, how are individuals and families and other people out in the community being informed of any policy or recommendation changes? I think, and I would ask Utah to jump in, but that's not a responsibility of the tool. The tool allows the state to come up with information. What the state then does with the information in terms of informing various stakeholders, I imagine each state and even each system within the state has their own means of communicating any changes or any opportunities with their various stakeholders. Would you guys agree, Utah?
Utah, if you're speaking, I think you might be on mute.
I'll jump in for Tricia in the event that that's what happened, but I think we try to use a number of our committees and stakeholder work groups to try to disseminate information that involves employment first legislation, as well as other changes to the programs that we have. Through other mechanisms, I think I'd agree that we're not looking to the survey to fulfill that role.
So, Arimide, what was the, thank you, Joseph. What was the first part of the question, Arimide?
The first part was, when the tool is used, will this help the state be able to recognize areas that are having difficulties with getting individuals hired for employment?
Well, I think what the tool does is it allows the state to think deeply about the policy in each one of the respective systems and how those policies do or do not work together. To the extent that some of the policies are not aligned, the state leaders can then kind of figure out that this is an area that we need to work on to make sure that the policy is aligned to help people get employed. So it helps with, yeah, excuse me, go ahead.
Oh, I was just going to add that I think a good example might be in the HCBS section. There are a few questions, or it asks across the service descriptions on whether or not there is specific language that encourages the provision of the service in an integrated setting for individuals in employment activities. So that's an item that we have been looking at, too, to strengthen language surrounding the support of our service definitions to ensure that that is kind of always in the back of the minds of our operating agencies, ourselves, providers. So I think it has led to a few opportunities to identify some of those areas that we can improve.
Great. Other questions, Arimide?
Yes. Could you further describe how your state implements Employment First? I heard you mention a unified state plan.
So, Joseph, is that something that you can respond to?
Unfortunately, not in as much depth as Tricia would be able to. No, I apologize.
Oh, that's okay. Tricia, have you been able to get reconnected?
She hasn't, but I'm going to have her call my cell phone.
Okay, great, great. So we'll get back. We'll come back to that question about the Utah Employment First state plan. You know, various states have various ways of promoting Employment First in the state. For example, Rose, do you want to give a few examples of what some of the states are doing?
Sure. I mean, some states have legislation that declare them as Employment First states. Some states have executive orders that, you know, ensure that they are an Employment First state. Some states even have Employment First plans that they have developed collaboratively with many state agencies, and that's sort of their blueprint for how to implement Employment First in their states. Other states may even, you know, may not have legislation or executive orders or a plan, but they still are, you know, have the Employment First principles that they're trying to implement as a state. Of course, we encourage there to be a written policy of Employment First, but we understand some states may be working on that still.
So again, a range of different things that the state can do, a state plan for some states that are really ahead of the curve, you know, they've gone to the step of actually gone through some of the things that Rose mentioned and are actually at a point of developing a plan. So just because your state doesn't have one yet doesn't mean that it couldn't have one. So if whoever is asking the question is someone in the community or perhaps a community rehab provider or employment services organization, you certainly explore that opportunity with your various state systems to see if that's something that they would be interested in and see if you might be able to collaborate with them in that process.
Thank you, Chris. Just to let you know, Tricia is back on. Hi, Tricia.
Anyway, I'm sure you guys covered a lot of the information about what Utah did. Our legislation passed in 2011, and the first thing that we did, there are several agencies named in our legislation, including Department of Workforce Services, Vocational Rehabilitation, the DD agency, Disability agency, and then mental health. And so we got together and created a unified state plan saying these are the things that we would do, identifying barriers and policies that inhibited the progress of Employment First after our legislation passed. And then we each kind of individually did some strategic individual agency work. And then really, I think, came together collaboratively and have made more progress since we've been involved in the Employment First State Leadership Mentoring Program since 2015. So it's certainly taken us some time to really get to where we are, and we still have a long way to go.
You guys are doing great things out there, so thank you. Any more questions, Aramide? We have time for maybe another question or so.
Okay. As an agency inputs data specific to their own agency, does that state or that agency have access to acquire that data for state use?
No, I was going to say, this is Richard. The only person who has access is literally the individual that's doing it. If you click Save Document, it asks you for an email. It'll only send a link that you only will have access to access that link. Nobody else has access to it, so it's all contained and private. So it's up to the individual filling it out, because technically anybody could, fill out this, for any just for their own curiosity or anything like that. It's just a self-assessment tool, so nobody else has access to anyone else's assessment. The only way you're given access to anything saved is through the link if you need to go back and start later.
So one last question.
that's it.
Oh, okay. In that case, I would love to give Tricia, Amy, and Joseph an opportunity to give any last closing thoughts or anything that crossed their mind as we were going through Q&A that they'd like to say about the most integrated employment settings tool. Tricia?
I don't have anything additional to add. Just thank you for the opportunity, and I do hope that folks on the call today will take the opportunity to go through and go through the tool. I think it's really, really helpful and worth really. So thank you.
Thanks, Tricia. We appreciate it. Amy?
I don't have anything really to add except that we're looking forward to the next steps and meeting to discuss the results and steps moving forward.
Thank you. And Joseph?
Yeah, I think just to reiterate that it's definitely worth the time investment to have this catalog completed. I think it's going to be a very valuable tool for us for sure.
Awesome. Well, we can't thank you enough for not only filling out the tool, but for your time today on this webinar. We know we fired some questions at you pretty rapidly, and you were able to answer them just incredibly. So, we thank you so, so much. To all our guests on the webinar today, we hope that you found this demonstration and conversation helpful, and we also hope that you will access the tool and use it in your state.
Yes, so on behalf of ODEP, thanks again to everyone for taking the time this afternoon. Special thanks to the leaders from Utah. You guys are just amazing and impressive, and we look forward to continued working with you and EFSLMP on the work that you're doing. And thanks to our collaborators, our partners at the LEAD Center, ODEP's Technical Assistance Center, who helps us with implementing these webinars. Thank you, Arimide, for your help this afternoon. And with that, we are going to sign off. Thanks very much.